Hi, I'm Kelly, a registered respiratory therapist with Blue Zone Health. Do you feel breathless much of the time? Are you unsure of how to manage your breathlessness? Is it keeping you from doing all the things that you would like to do? I'm here to help you learn to work with your healthcare team to come up with a plan that will work for you. There are lots of tools, tips, and tricks and breathing exercises that you can do now that will help you breathe easier and more effectively. I look forward to joining you on this journey and empowering you to breathe better. Hi, everyone. Welcome to the Cozy Lung Lounge. I'm Kelly. Joining me is Gina.
Hi there, I'm Gina.
We're continuing our series on the different lung diseases. So this episode, we're going to talk about sarcoidosis, silicosis, histoplasmosis, the osis diseases. I'm going to let Gina kick it. Yeah, there are. I'm going to let Gina kick it off because this is not my area of expertise.
Boy, this is kind of a collection of different kind of diseases that are out there. There are many more than this. This is not the only ones, but these are kind of the top three that we see. We're grouping them together today in this one episode because they're all interstitial or inflammatory lung diseases. These lead to scarring and fibrosis, shortness of breath. These are not COPD kinds of diseases, but a little bit opposite. And sometimes it doesn't cause disease per se in your lungs, but just you might have some scarring in there that they monitor over the years. Let's start with the first one, sarcoidosis. This one happens a lot with patients. It's an inflammatory disease characterized by growths of tiny clumps of immune cells called granulomas. Granulomas most often occur in lungs and lymph nodes of the chest, but they can pop up in other places. Now, we don't know what causes sarcoidosis. It's probably an overactive immune response to an unknown substance. It could be environmental, could be infectious, and this is in genetically predisposed people. And in my personal experience, I don't know any statistics, but many of my patients with sarcoidosis are African-American females. And so it may be that that's more a genetic predisposition in that population. Now, symptoms really depend on what organs are affected. You might have a persistent dry cough. Kelly talked about that in the last episode. Fibrosis diseases have dry cough, fatigue, shortness of breath. Sometimes you're going to have a skin rash or swollen lymph nodes with this. And you might have symptoms that develop slowly over time. They're probably not going to just come on real sudden, but they could. And so it's kind of a mystery, but where you're going to uncover the mystery is in imaging. So most often you're going to have some diagnostic tests. That could be a chest x-ray, a CAT scan. You're probably going to have a pulmonary function test, and then oftentimes a biopsy. And all of those things together would lead to a diagnosis. Now, there's really not a lot of treatment for this, and especially if your symptoms are mild, you may not need treatment. But prednisone is often a treatment for this. It reduces inflammation not only in your lungs but across your body. And sometimes you might be on immunosuppressants. But sarcoidosis, again, overgrowth of little immune cells called granulomas. What do you think, Kelly? Anything to add about sarcoidosis?
Well, it technically is one of the subtypes of the interstitial lung diseases because you're having the same kind of thing happening, except that the granulomas are present in this, where they're not present in the idiopathic or some of the other subtypes of ILD. And I know we talked in our last episode about steroids really won't help you, but with the granulomas present, steroids do help. And some immunosuppressants can help. So this is where the confusion comes in and why it takes so long to get this diagnosed, because everybody's got a similar group of symptoms and it just takes a lot of testing to really get down to the bottom of what's happening. I don't believe that sarcoidosis is reversible. It's manageable. I don't think I've had more than 1 or 2 sarcoidosis patients come through pulmonary rehab for me. What about for you, Gina?
I don't think so. I see them in the pulmonary function laboratory, but they tend to not be I don't want to minimize their symptoms, but they're not as sick or as breathless as other people. They're able to go about their lives much more commonly than other pulmonary fibrosis types of diseases.
And the two patients that I had that I can remember that had sarcoidosis had inhalers with them. And I kind of said, so do those help you? And both of them said, oh, yeah. So who knew? I mean,
and they might have asthma on top of that too. You could have a couple of different kinds of diseases in there.
They could. So for me, I'm always thinking, did the doctor just throw the inhalers at them because they didn't know what else to do? Or is it something these two particular patients says, oh yeah, when I feel the shortness of breath coming on, this definitely helps. If it helps you, do it.
Boy, I deal with that every day in the pulmonary lab. People like to grab that albuterol and breathe it in, where really they may need some oxygen or they may need breath control. There's lots of different reasons. But again, if albuterol is safe and you don't overuse it, there's nothing wrong with having a couple of puffs before you exercise. Okay, let's move on to the next one. This is silicosis. It's an occupational hazard most commonly. So it's a chronic lung disease that's caused by inhaling large amounts of crystalline silica dust. And that's going to lead to a lot of scarring in your lungs. Now, where are you going to get silica dust? Well, there's many factories around here. I know that they talk about silica dust on the job. Mining, glass manufacturing, foundry work, stone cutting, and other kinds of construction and brickwork, concrete work. And so every one of those is present in my town. I live in a very heavily blue-collar factory town, so we have all of those factories here. You're going to get a lot of shortness of breath, a harsh chronic cough, weakness, and chest pain. And you may not have symptoms until years after your exposure has stopped. And so I've been doing something lately. I'll give a shout out to Andrew Escobar. I know he works with our team in the fringes, but he talks a lot about occupational exposure and lung disease. And so from his encouragement, I now ask every patient, no matter who they are, what their occupational background is, whether it's office work or outdoor work. We make sure we put that in there. Even if it's asbestos when you were in the Navy at age 22, we're still going to put that in your record.
That's the thing about silicosis, is the symptoms don't often show up until years after somebody's retired, which is kind of odd. So somebody retires from stone cutting or construction or whatever they were doing, and then it's years later that they start really feeling bad.
Yeah, there's a lot of that. And, I wonder if that could translate to the vaping that we're seeing today. We may not know for 20 or 50 years what it's doing to your body, your mouth, your tongue, your teeth, all of your airways, all of those things. So we really don't know yet. This, silicosis, same, very delayed onset. Now, to get diagnosed with we're on silicosis. We're going to have a lot of history. Your doctor's going to take a history, a physical. They're going to make sure they can find a source of the silicosis. Even if you can't identify it, go through all the things that you might have been exposed to. You're going to have a chest x-ray, and where on the other kinds it was honeycombing, on this kind is eggshell calcification of lymph nodes. So that's kind of a classic sign that you might see on the x-ray. And then there's going to be some CAT scans involved also. And with other lung diseases, this is going to be permanent lung damage and scarring. And so if you have silicosis, we are going to focus your treatment on symptom burden. And so we want to make sure that your cough is protected, cough suppressions perhaps, oxygen therapy, and preventing infections. Tuberculosis, you think has been eradicated, but patients with silicosis may be more prone to tuberculosis. It might lower the immune system or have other mechanics in there that we're not quite sure why they're more susceptible to that. Once you get a label with silicosis, they're going to make sure that they take care of you in all of the different ways that doctors do. Make sure we get you enough oxygen. If you need bronchodilators for an asthma you may have, we're going to give you that. But generally, symptomatic support for that.
Absolutely. I think it's unfortunate that most people with silicosis don't even do pulmonary rehab. It's mostly supportive care at that point.
Hi friends, this episode of the Cozy Lung Lounge is brought to you by Hoot Nanny Joy, where your health and wellness take center stage. At Hoot Nanny Joy, we know how overwhelming it can be to stay on top of your health, especially when life gets busy or chronic illness adds challenges. That's why we've created self-study programs designed to meet you right where you are. These programs are simple, flexible, and packed with tools to help you thrive. And they come with something extra, access to a live health coach. That's me, to guide you every step of the way. Whether it's improving your sleep, learning to nourish your body, or managing stress, our programs combine proven science with practical, real-life strategies. You can work at your own pace, get the answers you need during coaching sessions, and feel confident you're making progress. Ready to take that first step? Visit hootnannyjoy.com to explore the programs and choose the one that fits your journey best. Hoot Nanny Joy, because your health deserves a little joy.
Well, we have a trio of conditions today.
Yep.
And so we're on to the third one. And I'm in the Midwest, and this surprised Kelly, but we all have histoplasmosis around here. I don't know about everybody, but it is very, very common. Histoplasmosis is an infection caused by breathing in the spores of fungus named Histoplasma capsulatum. And that fungus gets down to your lungs when you breathe, and it thrives in that warm, moist lungs in there. First, where do you come across histoplasmosis? It's in the soil. Soil can be contaminated by bird droppings and bat droppings, but that fungus lives in the soil. Very common here in the Midwest, the Ohio and the Mississippi River valleys. And so if you're going to disturb the soil, whether it's construction or cleaning out the garage, gardening, anything you do in the dirt, those spores are going to come out. You could inhale that. Most people are going to have good, healthy immune systems, and that won't cause a problem. So you really don't know if you have it or not. If you are a baby or you've got a compromised immune system, you may be at higher risk of symptoms. Now, symptoms for histoplasmosis are really a lot like the flu. We're going to have fever, cough, fatigue, and chills. And in chronic cases or those with a weakened immune system, we're going to have a higher symptoms. Might be a really, really higher burden of symptoms. And you might even have long-term issues such as in tuberculosis. But for many, many people, they just show up as spots on your chest x-ray. And if you have that, you're going to have a CAT scan. They're going to look at all of those nodules, and they're going to look at them. Radiologists, they measure them, and they look at the characteristics. And much of the time, they say, oh, this is suspicious for infection. It's a certain little millimeter. They have different guidelines that the radiologists go by. And so very often you may just get a CAT scan in every 6 months or once a year to monitor those kinds of things. If it's very severe, we can give some antifungal medications. You're going to have a blood test first to see if you have that fungus in your blood, in your urine, is it in your sputum? And so you're going to find out where it's at first. Healthy immune systems really can tackle that fine. But again, antifungal medications might be useful, and you may have to take them for several months. Anything like that in California, Kelly?
Kind of. I worry about all the gardeners out here that, blow. They run around with their little blowers, and not one of them's got a mask on, and just all the microparticles of silt, sand, dust, bird droppings, animal droppings, whatever else is blowing around out there. If you do any kind of gardening, I would highly recommend wearing a mask. And if you're a professional gardener, I really recommend the N95, the real N95, not the fake ones.
Now, I know it's not the same kinds of things, but out there in the desert, I've heard of hantavirus or hantavirus.
Mm-hmm.
That's kind of the same thing out in the environment.
Yep.
If you have one of these things, what are we going to do about it?
Well, it depends. So pulmonary rehab for some patients, but again, it may not do a whole lot for somebody who really has some deep scarring and or a really deep infection going on in their lungs. We may need to treat the infection first, Mostly it will be just keeping a patient comfortable. Titrating oxygen is very important. And unfortunately, there's other medications we can give. I don't know off the top of my head or what they are, but it's the same drill. Keep yourself healthy, eat well, stay up to date on your vaccinations, don't smoke, drink a lot of water. And I just another note is just acknowledging sometimes the roller coaster of emotions that go along with having a chronic lung condition. Just acknowledging you'll have good days and bad days. You'll have days where you can do a lot, and you'll have days where you can't do a lot. And that can be depressing sometimes. And just acknowledging that, this is hard. And just making sure that you speak up for yourself and stand up for yourself and find a doctor that's willing to really go the distance for you and do the testing that's necessary and try the different things that are available.
Now, in every case, we really want to stress self-care. So if you're still on the job where you're working with the soil, like Kelly said, make sure you wear your PPE. And this could even extend it to caves and chicken coops. So if you're a hiker going out where there's bat droppings, you really want to be aware of that also. We also want to make sure that you drink your water, keep yourself paced. Oh boy. And Kelly talks so much about mental health there. So really, I don't know if that was good news or bad news. It is what it is. Once you find a foe, you find that enemy, you're going to figure out your battle plan and go against them. And that's the same in this one. We're going to, whatever we get, that's what we got. And now we got to figure out a plan and move forward with it.
And it's never too late to protect your lungs.
Never too late. Well, that was a great session. I know we've got more lung disease coming for you next time. So I'll sign off today. Gina from Hootenanny Joy and the Cozy Lung Lounge. Seeing you later.
All right. Take care, you guys. We'll see you next episode.
Living with a chronic respiratory condition doesn't mean giving up the things you love to do. At Blue Zone Health, we're here to help you breathe easier and rebuild your strength. Our online cardiopulmonary rehab program offers tailored exercises, self-management training, and expert support from certified respiratory therapists. Accessible anytime, it's designed to reduce breathlessness, improve lung function, and empower you, all while connecting you with a supportive community. Visit bluezone.health and take the first step towards stronger lungs and a healthier future. Blue Zone Health. Breathe better, live better.